but when we combine them, we get a much better effect. We get a really large impact. The important thing to remember when we're administering contingency management, though, is that it's important that we look at the immediacy of the reinforcer. If there's a delay in providing reinforcement, we get much less effectiveness. The magnitude of the reinforcer is also important. It's got to be enough to kind of, I guess, be influential. And where we're focusing the reinforcer is very specific. So if we're looking at treatment attendance, we will see change in treatment attendance. We might not necessarily see change in number of clean urine samples that are provided. So it's very specific in that way. So then why might we look at new interventions and why might we look at the internet? So we've found that CBT is quite possibly a very effective intervention for amphetamine use, as is CM. That web-based interventions have actually been quite effective for alcohol and other drug use. There's quite a lot of literature out there now about that. We do still need more empirically supported web-based treatments, and there's no published research that I can find to this date for web-based interventions specifically for amphetamine use. So we're quite curious as to how that might go with this population. However, I guess we need to just double check that we have people in Australia that access the internet. Good news is really high rates of that, up around 80%. So there's quite a lot of people that do have that access. So there are some benefits of technology as well, that a lot of the time it can allow for increased access. So even today, having people accessing webinars, we can reach a lot more people, even health professionals, through using technology. It's also then thought that we could reach a lot more clients that way as well, particularly those that might be in more rural or remote locations, or even just people that struggle to